Thank you, everybody. Thank you, Joe. And yes, I'm so delighted to be joining this morning, listening to everybody, all the work that's gone on, everything, the opportunity, you know, what is there for the future is really exciting. So it's marvellous to be part of that. If I can work this. Yeah. So I'm going to chat about the interface between human and animal medicine. I started out as a vet. In my head, I'm still a vet. There was somebody this morning was talking about James Herriot, and I was looking at it going, yeah, 1970s James Herriot is what I was brought up on, and that's what I wanted to be. That was it. I loved animals, not that fussy with people, just want to work with animals. I'm going to be a vet. And I did do it for a long time, but, you know, family gets in the way. You know, what jobs can you do? What can you have childcare? All those sorts of things. So I ended up moving into education within the veterinary and the vet nursing side of things. And I did work in a department that brought together human nurses and vet nurses, and we taught them together. So we did all of that, and now I find myself working with physicians at the Royal College of Physicians of Edinburgh. So I'm now seeing things from a different angle and seeing the training, and spend all my working life with medics, as I call them. I appreciate human medicine as medicine and surgery, but I use the term medics to cover both. So I want to pose a question. Is there any difference? Because to me, animals, people, we're all living beings. I don't think there is a difference, but you might be arguing with me. So we're going to look a little bit at this. So this slightly random picture that we have here, I'm not very good with technology, but I did use ChatGPT, and I had in my head that I wanted this sort of star scene of all the different species on the planet, and somewhere in there would be people. So I asked ChatGPT to create something for me, and this is what it came up with. So every single dot, and there are thousands of dots on there that are making up these images, every single dot is a species. And I said, could you highlight humans for me, please? I still can't find it. I cannot find humans on there. I don't know where it is. But it's a really nice representation, and like you were saying, Matt, you know, that vets swear this oath for all of these species. So when we look at the actual figures, lots of insects. Insects are not covered in the Veterinary Surgeons Act. That's a whole other discussion. Neither are fish. But we have thousands, millions of other species, amphibians, mammals, humans are in there. Never mind all the plants for the botanists and everybody else that deals with all of that. So we have all these different life forms on the planet, lots of differences, but particularly as Matt has shown, lots of similarities that are in there. So why don't we work together? So I work at Physicians in Edinburgh, and we are lucky enough to have a copy, first edition, of The Origin of the Species. And we have a little display at the moment, which I'll mention at the end, and it's on display, you can go and see it. And I was looking at this and thinking, Charles Darwin, evolution, he was putting forward this idea about animals and people, and we're all very similar. Now, that was over 100 years ago that he was putting forward those ideas, very controversial as they were at the time, but we've kind of accepted this now in modern society. So again, why is there a difference between human and veterinary medicine? So, you know, what is medicine? So again, I went to the internet, and it gave me this definition that's the science or practice of the diagnosis, treatment, prevention of disease. Often taken to exclude surgery, but like I say, I'm including surgery in that because I'm aware there are some pretty eminent surgeons in the room at the moment. So thinking about that, I thought, let's look at the history of all of this, and let's just go back through time. So we have human medicine, and it's in the records going back, ancient Chinese medicine and Greek medicine, medieval times. Then coming through history, we then sort of developed into the surgeons and the physicians and the apothecaries. Royal College of Surgeons of Edinburgh was founded way back in 1505. Then the physicians caught up with London, Glasgow and Edinburgh, and we had the founding of the NHS in 1948. And that all has given a structure to human medicine. You compare that with the vet world, there are also records going way back to ancient times, Chinese medicine, Egyptian medicine, Middle Eastern medicine. All of these different areas, there are records of people treating animals. The Code of Hammurabi, or however we say that, I'm not entirely sure, is an interesting one. It's a lot of rules set out in Babylonia. And it covers human medicine and veterinary medicine. The particular mention of this on the RCVS website with regards to the vet world is that it was the first example of setting fees for veterinary medicine, in that if you cured the animal, then you were entitled to a certain payment. But unfortunately, if the animal died, then the vet had to pay recompense back to the owner. And I thought this was awful. But then when I looked at it a bit more, actually, the vets got off light. Because if you were a medic, if you were treating somebody lower down in society, sort of a slave or something like that, and they died, there was no problem. But if you were treating somebody very important and they unfortunately died, then you would have your hands cut off. So I thought, OK, I'd rather be the vet. But yes, so it goes back. We also have Hippocrates from the vet side and from the human side. But really, coming through, the first textbook that I could find was 1565, and that was horses, hawks and hounds, because they were the animals that were important to people. They were useful to us. Therefore, that's the animals that we cared about. And the first vet school wasn't set up till 1761, which is way after we have all these physician colleges being set up, and the RCVS in 1844. So we are kind of playing catch-up there. And I think a lot of this is to do with our attitude to animals. As I said, you know, that book was on horses and hounds and hawks. And if we think about how society views animals, are we viewing them as food? Are we viewing them as agricultural machinery? What is the place of animals in society? And everybody has a different view around that. And I think that comes into this conversation. So if we think about the actual art of medicine, being a vet or being a medic, and the similarities that there are between the two of them. So I started doing my list and thinking, OK, what do I think a medic does? You might argue with me. What does a vet do? So we can be a GP, a physician, surgeon, can be specialists, specialise in certain areas, cardiology, derm, etc. The vets, I sort of kept going and made it a broader spectrum, but public health is human medicine as well. But like I say, the vets are working in all these different areas. And is that one of the challenges, that because human medicine is so specialised and so focused, I have colleagues that only work with children who have epilepsy, and that's all they do every day of their working life. Now, whilst I have vet colleagues who are very specialist in neurology, I couldn't quite see it being that narrow. And I do wonder if that's one of the challenges that we have when we're trying to bring two sides together. So, working as a vet or working as a medic, I tried to find some pictures and say, well, you know, which one is human and which one is vets? And like we saw this morning, the kits that people are using, the environments that we're working in, you would be hard-pushed to tell the difference between the veterinary world and the human medicine world. So we have x-rays, we have all our diagnostic tools, the machines that go ping. They're all very, very similar. And indeed, when I had my own practice, most of my kit came from ex-NHS. This photographs I stole from my husband, who's a zoo vet, and he gets a lot of his kit from the NHS as well, I have to say. But variations on that is the sheer size. Now, the picture in the top right there, you can't actually see the scale in that photograph, but this is a huge ET tube for use in very big animals. But most of that will look familiar. We've got circuits, circles. We have all the different types of anaesthetic circuits and anaesthetic machinery that we're using. And Simon's doing a pretty good job at the moment of going round the NHS and talking to people. And they're all quite fascinated and quite interested in what he does. But it just didn't occur to people to ask in the first place. So we'll see where that goes. And if you're working there, so the top right photo has a dog in it, so we go, oh, that's a vet clinic. Bottom right has a dog in it as well. But the two photos on the left, are they vets? Or are they GPs? Or consultants? It is difficult to tell. And like I said, I came into this because I love animals. Then I realised you have to work with people. They do all come in with owners. And some of my medical colleagues say to me, oh, you're so lucky, Mary, you didn't have to talk to anybody. And I go, you should try spending time in a vet practice. I spent more time talking to people than talking to the animals, unfortunately. But it's very, very similar. In fact, I could say it's identical in some cases. I was a dermatologist at one point, so I just had to get some dermatology in here. And the conditions, I will go so far as to say they're the same. I'm going to come back to the atopic dermatitis. That's why I did my PhD in. And I spent most of my time learning about human diseases. We have various different pictures there. Which ones are animals, which ones are humans? Sometimes it can be difficult to tell. Like somebody said this morning, once you get it underneath the microscope and you're looking at it, it can be very difficult to tell the difference. So some other dermatology pictures, because I just wanted to get them in there. So particularly this one at the bottom, this was from way back when I was doing my certificate. This is a case of epidermolysis bullosa in a calf that was referred into the vet school. We have pemphigus foliaceus in the top right, and we have some hypersensitivity reaction in a dog. There's only so many ways the skin can respond to insult, and it's kind of similar in most of them. Similar conditions in other animals. Some of this has been mentioned already this morning, but the sort of things that came to mind where cattle can have Johne's disease, and think about Crohn's disease in people. Degus, I was surprised about this. I didn't know quite how much degus are used to model for human disease, for diabetes, for neurodegenerative disease, for cataracts. There's a whole variety of different conditions there. And again, I would argue that it's the same, particularly if they're all mammals. If we're dealing with mammals, there's a huge number of similarities. And then we have worked together. The development of vaccines from Jenner, from cowpox, then being developed into the vaccines for smallpox. That's a very old discovery. And what else is out there that we've still to discover and can take medicine forward? So just a little bit thinking about research, I then wondered, okay, where do we stand comparing the vet world with the human world? I went away again, did some research, 2022, and I think a lot of this is possibly post-COVID, which meant there was a huge figure here, but the UK spent $5 billion on human medical research. I tried to find some veterinary figures from the same time and couldn't find anything. But for 2023, I managed to find out how much Elanco and Zoetis spent. Now, these are huge American pharma companies. So this isn't just the UK from the veterinary side of things. But we're talking 300, 600 million. Really? Again, it's just emphasising the point of how much we are focused on the human perspective and not bringing all of it together and looking how we can work together. So then I wanted to just finish pulling all of this together, thinking about the world of education, which is what I know. This is actually in Ghent, if any of you are there. I was going to go and see the botany side of things, and I came round the corner and this building was in front of me, and it's the Zoology Museum in Ghent. And I was so taken by this picture, just showing you all of these other different animal species and the similarities between them. It's a pity there's not a human in the middle of it. But thinking about my own experience of going through vet school, these were my textbooks for first year vet school, and there might be some medics in the room that recognise some of them. Ganong's physiology I still have a particular hatred for. But you can imagine my disappointment as a vet student. You know, this is back 1989. I'm so excited I'm going to vet school. And this is my textbooks. And I went, where's the animals? Part of this was due to just a lack of vet textbooks because the market is quite small. But I thought, actually, it just shows you that lots of similarities. And I do wonder, I'm going to be slightly controversial here, and you can argue with me, but I do wonder if this is why vets are possibly slightly more open-minded when it comes to reading, finding papers and reading about human medicine. I don't know how any of the medics in the room would have felt if you'd had started first year medical training and presented with a whole load of vet books to go and learn. You might have been a little bit disappointed. So looking for that evidence, I have a question for you. So this was my PhD a long time ago on atopic dermatitis, and I was sent on a course, and I was sent to Newcastle Medical School to go on a course learning about atopic dermatitis in people. And I sat there as the only vet in the room, wondering, why am I here? But it was very informative, and it did help. But when we look for evidence now, and finding papers is now so much more easy than it was in the days of having to go to the library. And I teach evidence-based practice at Glasgow Uni. And so thinking as the veterinary professionals in the room against the medics in the room, if you're going to go and look up what's the latest on a certain condition that you deal with, would you ever consider looking at a paper on the human equivalent condition? Would anybody do that? Yeah, a few notes? Yeah, okay, brilliant. So the medics in the room, if you were doing the same thing and looking up a condition, how many of you would read any papers on cats, dogs, cattle, horses? Helen, I knew you would say that. Yeah, okay, so we got a few there. But again, maybe I'm being controversial, but I do think there's a slight difference there because of the availability of evidence over the years that has been there for us as vets. So this was a really interesting paper looking at the education side of things. Can we bring all these different groups together? So they were wanting to combine medical and veterinary education into this interprofessional education, IPE, and we learn from each other. Challenge, however, how do we actually integrate it? How is it no longer just a novelty? How will we get over that resistance that I admitted I had myself as a first-year vet student? Why am I studying human things? And I can imagine the medics would say the same thing. Why am I studying animals? So there are challenges out there, but we need to bring it together. Okay, my letters have gone slightly wonky. Opportunities for the future. So I mentioned Darwin and theory of evolution. So just to finish off and bring all of this together then, I want to propose that we now have convergent evolution, that we bring together the veterinary side with the medical side. And the evolution of medicine and surgery is that we all work together in one medicine. So, thank you, everybody. I have to mention the museum and our exhibition in Edinburgh is on Weldon Tame. And also want to thank everybody at the Humanimal Trust, my work, Physicians of Edinburgh, my husband, and all of the animals that have put up with me over the years, taking photographs of them. And you might not be able to read it, but the cat is actually sitting on a shelf of James Herriot and All Creatures Great and Small there as his favourite spot to sit on. But yeah, thank you very much.